Hey guys, this is Dr. Matthew Lucena from the Brain Spine Pain Institute, and today we're going to talk about our David machines here. And these David machines are excellent for taking objective data while also promoting good exercise to help promote recovery. So let's start from the beginning. Alrighty guys, so whenever you start in here, you're going to start at one place typically, and that's going to be here at our kiosk. This kiosk helps connect to our machines over there. So what you're going to do is each patient has a card that's associated just for them. For our sake here, we're going to use my card. You're going to scan right over here to our machine, and then essentially it's going to ask you how your symptoms are for that day. So at each location, I tell patients on a scale of 0 to 10 to rank their pain at kind of each location, whether it be shoulder pain, neck pain, back pain, hip and leg pain. They can rank it on that scale of 0 to 10. Kind of right over here as well, you'll see kind of my colored guy here. Essentially, I tell the patient that I want them to kind of color in where they're feeling pain based on the symptoms that they're feeling. So it could be pain, burning, muscle weakness, numbness, and tingling, and they can kind of color in where they're feeling new symptoms or changes in symptoms based on how we want to demonstrate how we are feeling today. Essentially, then we save it from there, and then we head over to our machines over here. So let's kind of talk about each machine. So the David machines in themselves are really helpful for help strengthening and promoting movement and kind of within the spine. And so let's first start with our neck machines. We have two neck machines here at the Brain Spine Pain Institute. We'll start here with this one. This one works on cervical rotation. So your ability to rotate your head from left to right. Okay, kind of just like that. And we have our patients sit in these machines to kind of work with resistance on some of these motions. And so going to our next neck machine here, this one's looking at our ability to promote what we call cervical extension and cervical flexion, as well as lateral flexion as well. And we can change the positioning of how they are based off what we want them to be working on. But essentially, if we're working on, let's say, extension and flexion, they're gonna work on that resistance kind of with their head pushing backwards against this machine, kind of just like this, okay? And so those are our two next machines. So let's look at our low back machines next. So let's talk about our low back machines. We have 4 low back machines here, each one again focusing and isolating specific motions, okay? So our first one here, just like our neck, we gotta look on our rotation. So the first one here is our lumbar rotation machine. Again, it's gonna look at our ability to rotate our bodies from left and then to the right with that weighted resistance, okay? And let's come on back this way. Next, we have our lateral flexion machine. This one works semi-similarly to the other machine, except this one's gonna work on our ability to tilt our body. So tilting from left and right, okay? And we have 2 more machines here on our back. This one works on what we call lumbar flexion. So our ability to kind of use our 6-pack muscles to bring ourselves forward and bending down, just like that. And then we got our workhorse here, I like to call this one. This is our lumbar extension machine. I really like to emphasize this machine because these ones work on a lot of our big back muscles responsible for lifting and sustaining our posture. And it works by just having the patient sit in this machine and leaning backwards like this against the resistance using their back, okay? So now let's kind of show what each machine kind of uses or looks like when we use them. So how do we use these machines for exercise? And so we'll use my friend Christopher here, and he's going to help us use this lumbar rotation machine. So essentially with this one, all I do is again scan his card that is connected to him, and it's going to help pull up his exercises for the day. And then so if I wanted him to first focus on resisted rotation to the left, I'm going to move and position him toward me this way. Make sure the weight that I add here is what is needed. And then essentially, I have some markers here on my screen that help him move through the motion. And then with a little bit of a timing and a timer, it helps him go through a specific pace of that motion as well. So, Christopher, are you ready? All right, so go ahead, you're gonna move to the left, keeping my exercise in between these nice green lines over here, and then also keeping with his pacing line on the right side of my screen to make sure he's not going either too fast or too slow, making sure he contracts those muscles properly. So after each exercise, we finish it up, And then on the following screen, it says and tells him how he did, and he can also report and tell me how stressful or how difficult the exercise was as well. So what else can these machines do? So usually on our very first day, we use these machines not for exercise, but to take objective measurements. And so what we do is, again, using this lumbar rotation machine, I have them have a seat in these machines, and we first look at their ability to move, or how far they're able to move using this machine going from left to right. And so using these machines, I create an amplitude test, again, looking at their ability to rotate as far as they can from the right and also to the left. And so with that, we're able to see where they are compared to the right and the left side for this machine, but also we're able to compare it to research-based norms based on their age, height, and weight. So we can essentially give them where they're starting versus also a goal that's consistent with recovery of symptoms as well. Lastly, what we can do on these machines is also measure their strength. And essentially they can look in the same exact way using their age, height, and weight to compare what is normal versus where they are now. And so, again, from this machine here, if we do a strength test, I essentially lock the machine in place, have them count down from 3, 2, 1, push in the desired motion as hard as they can, and they can see again where they're starting out versus where they want to be. So right here, it gives them a score. Let's say for this patient, it was 52 Newton meters. And we have it here on this black line. This is what research is showing, what is considered normal for their age, height, and weight. And so this is where they're starting with these green lines. However, this is gonna be their goal for symptom recovery. And so those guys are our David machines. And so again, they're really good for help strengthening and promote movement within our spinal segments, but as well as creating and establishing objective measurements to be compared to before and after we run through our program.